The highlights of the meeting this year at EHA really encompass not only menin inhibitor therapy, but also the results of the MORPHO study looking at the use of Gilteritinib, a newer generation FLT3 inhibitor, as maintenance therapy after transplantation for patients with FLT3 mutant disease. Although the use of Gilteritinib as maintenance therapy following allogeneic stem cell transplantation was not statistically different than placebo alone, there was a substantial difference in outcomes in patients who had FLT3 MRD positive disease. Obviously, patients who were MRD negative did not benefit from the addition of Gilteritinib, but there was a statistically significant improvement in those that had MRD positivity. This suggests that the use of molecular MRD for targeted subsets of AML is on the horizon as well. At this year's ASCO meeting, we saw data presented on mostly MDS and acute lymphocytic leukemia patients. Retrospective analysis and newer CAR T therapy for ALL appeared to be very promising, and the use of commercially available CAR Ts for ALL still result in very low CRS rates and very, very high overall response rates. We saw MDS being a disease that now has successful outcomes of 2 phase 3 studies. Luspatercept is now looking to be an alternative use growth factor for lower risk MDS patients, regardless of whether they have ring sideroblasts or not. And we saw telomerase inhibition with Imetelstat be superior to transfusions alone in patients heavily transfusion dependent with lower risk MDS that's resistant to erythrostimulating agents. So 2 phase 3s for MDS that could be potentially practice changing and encouraging data with CAR T for relapsed refractory ALL.